Welcome to the Pregnant Show once again with Euphemia Koleki Ayani. In our previous episode, we said the whole of this month is for the discussion of depression in pregnancy. And we are back again in this episode to continue with our depression in pregnancy from where we ended in our previous episode. Again with me in the studio, once again with me in the studio is Miss Mabel Kabute, our mental health nurse who is helping us with the discussion. Miss Mabel, you are welcome to today's episode.
Thank you.
So we are continuing from our previous episode discussing depression in pregnancy. In our previous episode, we talked about some of the causes of depression. So today, can you tell us some of the things we should look out for, like signs and symptoms of depression in somebody?
Okay, so thank you very much, and then hello to your viewers as well. Okay, so it's good to be back again. Well, some of the signs and symptoms that you look out for depression in pregnancy or postpartum could be that easy fatigability. The person will be tired easily or
Thank you. I wanted to tell you that come to our level.
The person who easily get tired or there's a loss of energy. And then also loss of pleasure in activities. So for instance, if the person used to watch TV a lot with the family, when depression sets in, the person will no longer be watching TV, be interested in watching TV, or be interested in maybe, let's say, washing, cooking, if that's what they used to do. Yes, the person will no more be interested. And then also, the person will have the feeling of worthlessness, hopelessness. Yes, the person will begin to experience that feeling of I'm not worth it. All hope is lost. There is no need living. The person also sometimes has this suicidal thoughts. Suicidal thoughts. So self-harm and then harming others. So if it's a woman postpartum, then you should look at the woman trying to harm the baby. Trying to not having the bond with the baby and then would want to harm the baby. It's because of depression that you see that. And then also there will be loss of appetite. Yes, and then loss of weight. There will be loss of appetite, loss of weight in the person. And then also, we could see that the person who, in some women, there will be their personal hygiene. There will be changes in the personal hygiene. So virtually, the person doesn't really care about anything. Doesn't really care about. The person isolates a lot. Person can isolate, always crying. Yes, because you always see them crying without any reason. They are just crying. And then irritability. Some of them could easily be irritated by the slightest thing. They will just be off. Yes, it is because of the depression. And then we could go on and on with a lot of symptoms that you could look out for.
Some of the signs that you mentioned are very common in our everyday activities or in our everyday life, like getting irritated with the slightest thing, not interested in some activities, isolation. I wouldn't want to say that, I wouldn't want to say that we should say if somebody begins to isolate herself from society or from friends and people, it means that the person is depressed. We should not look out for just one sign. We should look out for many, because as individuals as we are, definitely you see somebody isolating herself, not doing certain things, just one or those of the signs you've mentioned, then we end up saying that the person is depressed. If we don't take care, we would rather end up depressing the person before the person becomes depressed.
Yes, that's true. So we don't look at just one sign. To conclude. We look at various signs, and then we don't look at it like 1 day, 2 days. It should be consistent. For a period of 2 weeks, 1 month, and the person is still like that. Then we know that there's a problem. Yes.
Thank you very much for that. So when it comes to when somebody is depressed, or when you meet somebody depressed, what then do you do for the person? How do you treat the person?
Okay, so you are in a home with a person like this, and you've observed the signs and symptoms I just spoke about for like 2 weeks or more. The person is still like that. You need to seek professional help.
Okay.
You need to seek professional help as soon as possible. So you go to the hospital, any mental hospital or any hospital. We have units everywhere.
Yeah.
So you go there and then the person will be assessed. Based on assessment, we can draw conclusion and then give a definite diagnosis.
Okay. So on that note, we'll be taking a break and we'll be right back. Welcome back from that quick break. If you've just joined in or if you've just popped up on your screen or your phone, it's the Pregnant Show with me, Euphemia Koleki Ayonu. Today we are discussing depression in pregnancy, or the whole of this month we are discussing depression in pregnancy with Miss Mabel Kabute, our mental health officer. We are back. So we're doing treatments of depression in pregnancy, right? Okay, so kindly continue for us.
Okay, so some of the treatment options that we have psychoeducation, psychotherapy.
Okay.
We have cognitive behavioral therapy.
Okay.
We have various situational therapies. We have a lot of therapies that we take them through. And then also we have medications that we give.
Okay.
So even in pregnancy, and then after pregnancy, we have specific medications that we give to them. But we always advise that you consult your doctor before taking any medication. Some people would want to self-medicate, which is not advisable because you might harm the baby, you might harm yourself. So it's always better to seek professional advice on the exact medication to be given to you, especially when you are also breastfeeding. We consider all that. And then we have the realization techniques and then counseling as well. So these are some of the treatment options that we have available. And when we take them through, it works for them. They are able to come out and then live their normal life.
Okay. So as a mental health nurse, you do counseling?
Yes.
Okay, so should anybody need counseling, we can call on you.
Perfect. Just call me.
Okay. With the therapies that you've mentioned, can one opt for any of them, or you as a professional, after diagnosing the person, you determine the therapy the person needs?
Yes, we determine the therapy because there are some of the therapies that will work for A, will not work for B, depending on the situation, depending on the level the person has gotten to. So we consider all that and then based on our assessment, give you the therapy that will work for you.
Okay. So in the health facilities or in the hospitals, should a pregnant woman be admitted? Do you meet the pregnant woman on admission, or you book appointments where she comes to you on daily basis?
Okay, so when she's on admission and we look at the situation, we have to be going to the to her on admission. We do that. Yes, I have to go see her, assess her, do my session with her briefly, not to stress her up a lot. So then we take it from there. We monitor progress. If she's discharged, we continue.
Okay.
So most of the time, I go to their homes. Most of them opt for home services. So I go to their homes and then offer the needed counseling for them.
Okay. Before we go, in midwifery, we have women in our communities who deliver pregnant women on our behalf. We refer to them as the traditional birth attendant. When it comes to mental health, do we have people in the community like that?
Yes, we have volunteers in the community.
Okay.
Yes, we have them. When you look at the community psychiatric units, we work with volunteers.
Okay.
So just as the midwife and then the CPNs, the community psychiatric nurses and then the community health nurses. Just as we have volunteers that help in the community, we also have volunteers that help us. So they even refer people to us. Then they say, oh, this person is like this. Come and look at her. Come and look at him. So they also help us a lot.
Thank you so much, Sister Mabel, for coming. Thank you for coming to educate us so much. We are so grateful. We appreciate that you are here with us. Thank you. So viewers, thank you for watching. We are ending this episode that mental health can happen to anybody, can happen to any of us. So please, as we are out there, let's look out for the signs and symptoms that our mental health nurse have mentioned. If it is happening to you, kindly visit the hospital for early treatment. And if you find anybody around you who is suffering any of the signs that we have mentioned here, kindly take the person to the hospital early for treatment before it ends up in a different condition. Thank you for watching. Don't forget, after watching our video, like it and share it. Also subscribe to our YouTube channel and press the notification bell so that anytime we upload a video, you will be notified of it and then you watch. Also follow us on our Facebook channel, Euphemia Koleke, on our Instagram, The Pregnant Quarters. Thank you for watching. See you on our next episode.